to introduce you. Hello, everyone. Welcome to the PAPERI webinar series. I'm Wafa Rashid, Chair and Founder of PAPERI. I will be today's moderator. Thank you for joining us for our session on bridging the genetic divide, driving equity, testing, and transformation across Africa. I'm delighted to introduce our esteemed speaker, Sainabou Laye Ndure. Sainabou Laye Ndure is the founder and chairperson of the Human Genetics Awareness Association, HuGAA, an organization committed to advancing genetic literacy, equitable access to testing, and genomic infrastructure across Africa. She holds a master's in genomic medicine from the University of Oxford and is currently undertaking her PhD at Queen Mary University of London, focusing on polygenic risk scores and rare disease genes. Through HuGAA, Sainabou is building a Pan-African movement to bridge the gap between underreserved communities and the evolving world of precision medicine. Her work centers on empowering communities, promoting culturally informed education, and building partnership with global research institutions to foster inclusive genomic research. She envisions a future where African populations are fully represented in genetics research and where genetic testing and treatment are integrated into everyday healthcare. In this session, Ms. Sainabou, as the founder and the chairperson as the Human Genetic Awareness Association HuGAA, will share her vision to transform Africa's genomic landscape by making genetic knowledge and testing equitable, accessible, and integrated into healthcare. Drawing on her work and studies in genomic medicine and her leadership of HuGAA, Sainabou presents a model of Pan-African progress noted in collaboration, education, and representation. Please join me in welcoming Ms. Sainabou. Please note that we'll have a live question and answer session at the end of the webinar. You can write your question in the chat to submit your question. Please mute your microphone. Also, this session will be recorded and will be available on our YouTube channel. Ms. Sainabou, the floor is yours.
Thank you very much. Good afternoon, everyone. Thank you very much for joining. I am Sainabou Laye Ndure, and I am the founder and chairperson of the Human Genetics Awareness Association. So today we'll be discussing on bridging the genetic divide, driving equity, testing, and transformation across Africa. So for the outline today, I will give a brief introduction about myself. I would give an overview of HuGAA. I will give an introduction to what I mean by the genetic divide and genetic literacy and destigmatization, how we're going to integrate genetic testing in healthcare, on building African genomic resources, HuGAA's mission and impact, and the future vision and a call to action. Okay. So to give a brief background about myself, I have my undergraduate degree from the Issa Maternity University in Northern Cyprus, where I graduated as a best graduating student. I have my master's in genomic medicine from the University of Oxford through the Mastercard Oxford collaboration. I am currently a PhD candidate at the Queen Mary University of London, where I'll be exploring polygenic risk scores and rare disease genes. And a bit more about my background, career-wise, I have been a scientific officer at FRC Gambia at the London School, and I've also worked as a project coordinator for the Global Health Network. So I identify as a Gambian geneticist and advocate, and also the founder and chairperson of the Human Genetics Awareness Association. So to give an overview of HuGAA, it is currently registered in the Gambia, and it stems from a passion of genetics and observing how some particular people are stigmatized in local communities. And the key objectives that we have is, one, to educate the public, to destigmatize genetic diseases, to support and to provide counsel for the necessary people. And we do this through workshops, through social media campaigns, through collaboration with other organizations. And we also engage with local media, such as the TV. I've done a few TV interviews. And currently we have over 60 members. And this is because there was a cap when we just started. But from now we have actually opened this up, and we're open to more people joining in. So to give an overview of HuGAA of, and how this relates to genetics. So to give this talk, we must talk about firstly, what is genetics? Now, when we say genetics, we mean the study of our genes, of our DNA. And what is the DNA? If you want to go deeper into it, the DNA is our instruction manual. It's the body's instruction manual that it uses, and it is stored in the human cell. So the DNA is made up of bases, letters you would call them, which is A, T, G, C, which we technically use all around. And your body uses this information for everything that it needs to do. And these DNA sequences, they make up genes, and these genes are then made into proteins that your body uses for different functions. So what happens or what causes a genetic disease? So genetic diseases are caused by a change in this DNA sequence, or an insertion, a deletion in the sequence. So what happens when it's more than one base? It can be a whole chromosomal change. It can be a whole regional change, but these have different impacts on the gene that is being transcribed. So genetic diseases can be inherited in different forms. It can be inherited in autosomal dominant form. It can be inherited in autosomal recessive form, such as sickle cell, whereby you need both to inherit both faulty genes from both parents. It can be X-linked, which you inherit from either mother or father, or it can be Y-linked, which means you're inheriting it from your father, or it could be mitochondrial. And research recently shows that this mitochondrial is also inherited from the mother. It can also be de novo mutations, which would mean that it is spontaneous. It just spontaneously happened. And sometimes environmental factors can also contribute to these genetic diseases, and which would lead to what is being called as epigenetics. So like I mentioned earlier, HuGAA is founded in the Gambia. And in the Gambia, what genetic diseases we have identified one is sickle cell anemia, and I think this is more pronounced in West Africa, not only in the Gambia, whereby the normal red blood cell shape is changed into a sickle form. We have ptosis, where the eyelids seem to droop, one more than the other, or both sometimes, and also hemophilia, where it's the body's inability to clot, whereby if you have a cut, for example, if for a healthy individual, it can take almost immediate or at least a few time, or for someone with hemophilia, it's almost little to no stopping. So those are some of the genetic conditions in the Gambia, and I'm pretty sure other countries will also have their identified genetic conditions. So why is genetics important in this particular context? Why are we talking about all of this? So because understanding your genetics can, especially if it's in relation to a disease or to a predisposition, it can help you understand disease presentations, because diseases can present in different ways to different people or in different people. You can have the same disease, but patient A might be worse in terms of condition than patient B. It can help in developing drug therapies. So provided we know what genetics we have, you can tailor these drugs to work on you, because sometimes people can be prescribed certain drugs and it will not work on them because their genetics, for some reason, does not tally with this particular drug, or they can have reactions to these drugs. Genetics is also important in personalized treatment, because if we know what you have, treatment can be tailored to you so that it can fit what you need to do. There's also, we can also be using your genetics for disease risk predictions and to provide accurate diagnosis. And for the risk prediction, this is something like using polygenic risk scores. It can also help in family and reproductive planning, because if you know that, for example, you're predisposed to a certain condition, you can work around how you want to plan your family. Should you choose to have children, you can actually do, for example, IVF. it also helps with prevention and early detection. So when we talk about the genomic divide and Africa's underrepresentation in genomic data, what are we talking about as a whole? So despite Africa being home to approximately 17% of the world's population, we are represented in less than 12% participants in these genomic studies. The global genomic database is very skewed towards the European ancestry. And even when we see what these African data is, most of the time they are from African American subjects. So we still as Africans are not properly in this data. And this imbalance is what I would refer to as the genetic divide. So why does this matter? It matters because researchers will miss out on the rich genomic diversity and the potential patient benefit that Africa harbors. There's so much that we can learn from our own genome. And as Africans, we have 25% more genetic variants than other populations. And this can be very crucial in developing therapies because if Africans are not included in these genomic findings, then it would be very difficult when therapies are created, or for example, even the next pandemic. We need to be represented so that when anything comes out, we are in the mix, we're able to use it. Because otherwise, this can lead to more health disparities and has implications for our health, such as misdiagnosis, such as ineffective care, which is also, for example, with prediction, like I mentioned earlier, polygenic risk scores. Most of those tools are using European population, and it's not when you try to use that same tools for African populations, it's not properly represented, or it's not giving accurate results. And this eventually would have long-term effects. So we need to bridge this gap. We need to find a way to fill in these missing pieces, which is our genome not being represented adequately. And when we say bridging the gap, it is not only a matter of justice or a matter of scientific progress, but it also ensures that equitable healthcare is in the pipeline, because these discoveries, they'll benefit everyone. And it's not individual or it's local, it's going to be global. And it allows us to unlock these new genetic insights because, like I mentioned earlier, Africa's rich genomic diverse database can hold, for example, disease resistance. And you wonder, for example, people that are sickle cell carriers are resistant to, I would say, somehow resistant to malaria. This is something that we can study. Or for a more typical example would be during the COVID pandemic. Why was Africa's death toll very low? There could be something there that would be very beneficial to read. So we could be a driving force for the benefit of its people and the global community. And us as Africans should not be bystanders in this genomic revolution. And this conviction is what underpins HuGAA's mission of driving equity and transformation across Africa's genomic landscape. And how do we do this? We try to empower. We try to empower through knowledge, through informed decisions, and that's what we mean by genetic literacy as a public health and equity issue. It is not a luxury only. Promoting genetic literacy isn't a luxury. It is a necessity. It is a public health necessity because when communities understand genetics, they can make informed decisions about health. They can make informed decisions about their reproduction and disease prevention as well. Because conversely, lack of knowledge, it breeds stigma and it breeds fear. And in many cases, genetic disorders are misunderstood as curses, especially if it's maybe new or it's not known to the community. It can have very dangerous effects, especially on people. They can be isolated, they can be ignored, they can be pushed out. So these are all things that we need to look at. So in this case, stigma can be deadly. So we need to work on equity and inclusion because information gaps exist. urban populations are more likely to receive this information that I'm speaking of than those in the rural areas. So a typical example would just be using this meeting that we have here. I'm speaking on Zoom. And then you look at some people in the rural areas, they might not be able to access Zoom. So these health disparities, they already exist as well. And every community has the right to understand the genetic factors that affect their health. They need to know what's happening. Because when you know what's happening, again, you can make informed decisions. You can know that, okay, for example, this that I have is a medical condition, or what my child has is a medical condition. And I should seek help. I should get other people to come on board and not be isolated. And thereby, when you know what's happening, when you know it's medical, it kind of removes a certain unseen load off of you. And there's some of the things that HuGAA works towards, which is to raise awareness, to make sure that other people are understanding what's happening. And if you look at the case, such as sickle cell anemia, over half of African children born with sickle cell disease die before their fifth birthday. And that is a very big statement. And so it is also a very large number. But this is in contrast to high income countries where sickle cell is routinely screened for and managed. And most of their patients, they survive until adulthood. And this is very different from what we're seeing in Africa. And that also leads us back to what we're talking about, destigmatization through education, through outreach in culturally appropriate ways, encouraging people to talk openly, to seek medical care from support networks, because an informed public is a healthier public. And in turn, genetic literacy builds trust between people. Okay, so when we say we want to destigmatize, what are we talking about? As an association, for example, what do we mean? So when we think about destigmatization, we mean removing shame and social stigma associated with something. And in this particular case that we're talking about is genetic conditions. And in genetics, the aim is to change the perspective of hereditary conditions from embarrassing or from taboo to a medical condition as is what it is. So why does stigma happen? Little public discussions. People don't want to talk about it. And we need to talk about it so that we can destigmatize it, so that it's not going to be an issue anymore. There's lack of accurate information. If you don't know something and you ask another person who doesn't know but just chooses to give information, you can end up being filled with superstition or blame. And this is again rooted back to what we want to avoid, what we want to remove. Some people in some particular instances can be accused of being cursed. For example, if there's a repeated miscarriage that people don't understand why it's happening, and there could be a reason somewhere. It could be maybe the parents or the couple in this particular case have a particular genetic, how will I call it, a way in that they're not compatible in some way, or there's a disease that the embryo is getting that is allowing for it to not be for it to be fatal to that embryo. You don't know these things unless you look into it. That in that way, this can then be avoided. So that is one of the reasons why stigma happens. Little information and little public discussions. So how do we destigmatize? So that's going to be through education and dialogue, because I believe knowledge replaces fear. And in this picture I've attached here is of me speaking on a TV show, TV, television, radio in Ghana called Paradise TV. And it's just one of the few that I've done. And we try to do this also through community seminars. We want it to be included in the school curriculum and people to know in any form or format that we can. And media campaigns as well, and to normalize conversations about genetics. So HuGAA has held workshops explaining basic genetics and specific diseases in an accessible way, and this can be accessed through our platform and our website as well. In order to destigmatize as well, another thing to do is the language that we use to ensure that we're using an inclusive language. Language is very important. Communication is very important. We hold so much power in how we describe something, and I think it's working around this to make sure that we're always respectful when we speak to other people, especially when we're describing something that they have, can go a long way. So, for example, instead of using derogatory terms for someone with sickle cell disease or saying that they look a certain type of way, you can just say there's a person that is living with sickle cell disease. Another way is for support networks. We as human beings, we love to be in groups. We love to be with people that we can identify with. And having these support networks can allow some individuals to be open to receive the care they need, to receive the connection that they need, and to be able to ease so much mental load of themselves. And that is something that is definitely needed, support networks. And we need healthcare integration. And when I say healthcare integration, I mean things like genetic counseling or support counseling. For example, if there's a diagnosis, you'll want to be able to find someone you can talk to who can at least help you live with this new diagnosis that you have. Because destigmatization is a community effort. It is not a one-person effort. It is not one organizational effort. It is a community effort. And like our HuGAA motto says, together we educate each other. So now, wait, my slide is okay. How do we integrate genetic testing into African healthcare systems? There are current challenges, and I think there will always be challenges in whatever anyone chooses to do. So, current challenges is genetic testing is not yet part or a routine part of healthcare. In most hospitals, in Gambia especially, it is not yet integrated. And this is something that we need to do because most of the time, patient samples are sent abroad for testing. So either to Europe or another part of Africa for testing, because it is not something that's central in our most countries yet, at least. There is limited trained genetic professionals, such as clinical geneticists or genetic counselors, because what will happen is if you now have even the sequencing instrument and you're able to do this, or you're able to find any type of facilitating means to get these diagnoses, you don't have the professional to interpret it. Then in that case, what do you do? So we have limited trained geneticists and we need more. We need more clinical geneticists, we need more genetic counselors, we need more trained professionals in turn. Many countries have newborn screening, but most African countries don't. And this causes a missed opportunity to start early treatment. There's so many information that can be gotten if there's anything to identify in this newborn screen, and we're missing out on it because we don't have it yet. Some countries I want to believe are doing that now or are trying to implement it now, but for now I know it's not widespread. Another barrier to access is the cost. It is quite expensive, genetic testing, and I think in some particular African countries it might not be a priority because they would have, in some cases, maybe maternal issues or other political issues that they might deem as more important, which I beg to differ. But this is something, again, that is a barrier and we need to work towards, or at least find a way in which we can work around these barriers. And another thing is up-to-date knowledge in genomics. So if the healthcare professionals are not updated on genomics or genomic knowledge or know what is happening, they are less likely to refer other people to get genetic tests done. So we need our healthcare professionals to also have up-to-date knowledge on genetics. However, there is some progress that's happening. Some African countries are establishing clinical genetics units, such as in Kenya, in Ghana, and South Africa. I think some projects such as the GH genome, which I believe is representative of Ghana. So we need to build an African-led genetics database. How do we build an African-led genomic database? So, or why an African genomic database? So because we need to be the lead in building our own genomic resources. So there are current landscapes, such as current projects happening like the HC Africa Consortium, there's a Nigeria's 100K Genome Project, and a vision for African genome reference that's articulated by Ambrose Wankam. But we need to be at the forefront of building our own genomic databases. And this can benefit things such as using polygenic risk scores, for example, to predict diseases. If we have our genomic database that we can use, and again, this is not something that would be a local benefit, but a global benefit. Because like I mentioned earlier, we have at least 25% more genomic diversity than other populations. So these infrastructures, for example, like I was saying, using project risk scores to predict diseases, for example, in African populations, if we have that, it can go a long way in ensuring that there's less burden in healthcare systems, there is early detection, there's so much that we can do. And I believe that as Africans, there's so much that we can get done when we unite together, when we use our expertise together. So we need to build also ethical leadership and trust, because there are some particular communities that are used to researchers coming in and extracting data from them. So whether it's through blood samples, in any sort of study that they're doing, but they're not getting something back. So we need, in order to build the trust, we need to let them know, okay, this is data that we're going to be using, that we're going to feed back the results to you as well. And this goes in line with addressing historical mistrust, and we need to build protocols for consent and data sharing. And like I said earlier, this is by the time we have this African genetics database, it is not going to be a local benefit, although it would definitely have a local benefit, but it would be a global benefit, and it would be a win-win for the world. And we want, in order to do this, want to do it through collaboration, through education, through representation, because collaboration is key. There is no single country or no single organization that can transform African genomic landscape. It requires a pan-African collaborative approach. It requires everyone to hop on board and work together. They will be able to do this together. And with global partnerships on equal terms. So what this means is when we get funding or when we get projects, we want to have equal benefits from it. Not someone just coming and extracting, but to work together to ensure the mutual beneficial relationship is in play. Another way we can do this is through education and capacity building is the foundation for any sustainable progress. And education is definitely at the forefront of this, not only public literacy. So public literacy is one thing, we need the general public to understand what's happening, but we also need in-depth education. And we need hundreds more of African geneticists and bioinformaticians, genetic counselors. And some African universities are now offering master's or PhD in human genetics. I know South Africa does. And this is amazing in making sure that we are at the forefront of this genetic evolution that's happening, because representation matters. So what would happen before is most of the time Africans were not at the table, but things are changing now. We are there and we are able to implement this change that I'm talking about. And it makes me very glad to know that hopefully in next couple of years, we are able to fully represent where we come from. So what is this Pan-African progress model that I'm speaking of? In summary, the model we as HuGAA are proposing has three pillars, which is of collaboration, education, and representation. So collaboration builds networks that enable large-scale projects and resource sharing, while the education will build the human capacity we need to carry the work forward and ensure preparation of the next generation. So while representation, of course, will ensure the research and its outcomes will serve the African interests and the African voices guide the global scientific discourse. But through this model, of course, we aim for nothing less than a transformation. And Africa, where genetic services are accessible to all, and African scientists are making discoveries that benefit the world. Because we can do that, and we will do it. And a future where Africa leads in genomics. This is a call for action. And when I say a call for action, I want us to hop all in together and get it done. What we as HuGAA envision for the future is quick diagnosis of rare diseases. Currently, it takes a very long time to be able to diagnose a rare disease. It is quite expensive. And it is something that we definitely want to cut down the time of, and want to develop new therapies, cutting edge research. Want to strive for a future where Africa is where Africa fully participates and leads genetic revolution. And again, why does your involvement matter? It matters because we can't do it alone. We want researchers to play a part. If you're a researcher and you're looking into something, include genetics in it. Ask about the part of where genetics can be involved. If you're a funder, ask, okay, what can genetics benefit from this research that we're funding? If you're an educator, I want you to think about, okay, how can I include this in the curriculum for someone else to benefit? as a health professional as well, where does genetic play a part in this? Everyone has a collective part to play in this call for action. I think that we will benefit a lot should we all come together to talk about it. So join HuGAA's movement. Like I said earlier on, HuGAA is short for the Human Genetics Awareness Association, and we welcome new partners and new members. And you can scan this QR code in case you want to join in. And we want to work together for the collaborative effort for a genetically inclusive world where no region is left out, where we make sure that everyone is fully represented. So we should be ready either for the next pandemic, like the COVID pandemic was, or for the next cure should it come, to make sure that we are benefiting from it as well. There's this proverb that says, if you want to go fast, go alone. If you want to go far, go together. And we choose to go far together. We want everyone to come involved and want to do things together. So let's work together, let's train each other and advocate together so that genomic advances uplift everyone. We want the mother in the rural village to have the same diagnostic chance as the mother in London or in New York. And I believe we can do it, because why not? We have the vision, the talent, the collective will, and I believe that we can drive transformation. So to conclude, I believe I've spoken a bit about the importance of improving genetic literacy in Africa, that there's a severe representation of African data, how we should integrate genetic testing into healthcare, and how paramount it is to do that, how genomic equity is achievable, and African genetic diversity is a strength that can fuel scientific breakthroughs. So please do get involved with us, and I'm open now for any questions that you should have. Thank you.
Thank you so much for this very informative presentation. We now open the floor. Uh, we now open the floor for questions from our audience. If you have any question, please use raise hand feature or type your question into the chat. I will address as many questions as possible within the allotted time. Thank you. Baba Fona, yes, you raise your hand from Gambia, by the way. Baba Fona from Gambia, please start.
Okay, thank you so very much, my mentor, first place. Madam Sainabou, thank you so much for that presentation. Unfortunately, I was supposed to be your moderator, but for a reason beyond my control, I could not moderate. I'm not sure I have much a question as such. I just want to commend you for that brilliant presentation. And the way forward, I think you should have our support. I work with the Minister of Health, mainly at the teaching hospital, although I'm pursuing my PhD on microbiology, like I sent you an email. But my challenge now, our problem now will be, I'm sure you must have engaged our ministry, that is the Ministry of Health. I think you will definitely need a representative at that high level, not even at the hospital level, because if the Ministry of Health, including the permanent secretary and director of health services are involved, maybe they can have it incorporated into our routine, test. I know what they routinely ask for is the sickle cell, and that is the pregnant women. Normally, they screen for that. So, but if you move on, and also at the community level, sometimes the community leaders matter a lot.
Yes.
So if, for example, I'm sure you must have actually engaged community, leaders. Because sometimes even if the Minister of Health staff, come into a community without engaging the community leaders, there might not be anything, progressive. So I think you can also note that the community leaders also are very much important. The other point you made mention, which is very, very, very important, that is the educators. How do we get our educators to get this thing incorporated into their curricula? From a high school level. Because high school, I remember when I was going to high school, I think it's still happening. I'm talking of early 90s when we had biology wherein they talk about genetics. So most of the time, most of it, even the genetics I still remember, I get them from high school. So even at high school level, at tertiary institution, like college level, you may, your association may even start engaging them so that they can have it incorporated into their curriculum. Once that is done, I think we definitely have a way. For now, I think these are the points I have. Once again, well done. I'm so happy, that you handled it quite well. My moderator, thank you so much for everything. Bye for now. Over.
Thank you so much. Do you have any comment?
I think
No
I think
comment.
I think what Baba said is right, and I'm sure I'll follow up with him. We have been in contact with the ministry recently, or earlier in the year actually. We did a uniform donation whereby HuGAA donated over 160 uniforms to the public health staff, so that's the nurses as well. And through there, we have built a network with the Ministry of Health, and we do hope to further that connection that we have to go deeper into it. So one of the things that we are planning on doing, like Baba has mentioned earlier, actually about the education, would be to deliver workshops. So HuGAA has done an introduction to genetics webinar where we did like a November series. We had like four we had one every week where we taught genetics to the general public, and we plan to do that again, but on a more personal level, at least for educators or medical staff for the Gambia. This is something that we would have to work with the ministry with and see how we can best do that. So thank you very much, Baba, for the comment.
Is there any question from our audience? Or can I will ask your question from the start. There is Naziha. I hope if Africa had genetic data in the future. We hope so, Naziha. Naziha from Libya. I have a question for you. What inspired you to establish Human Genetics Awareness Association, HuGAA, and how it does address the specific challenges in Africa's genomic landscape?
So what inspired me to start it? So
Yeah.
firstly, it was a personal instance where there was a child I knew growing up who was always isolated and just as a baby actually very isolated, not helped around it a lot, and I participated in that ignorance. So when I went to my undergraduate study and I learned about spinal muscular atrophy, I learned from then that, oh, this child actually had that and was a textbook had textbook symptoms of everything that was spinal muscular atrophy. So since then, I've always had at the back of my mind that I feel responsible to advocate or to educate whatever it is that I get from this studies that I'm doing to make sure that I am replicating it or I am taking it out for the general public to use, just to make sure that I am transferring the knowledge. So HuGAA currently right now we're doing the advocacy. Well, how can we do it in genomic diversity and genomic testing, like you're saying? So aside from just teaching it, we do plan to eventually, and this is very long in the pipeline, find a way where we can promote or at least advise for the inclusion of genetic testing. We're already doing the inclusion of genetic testing, but just to find a way where we can actually participate in getting the work done. Right. So because I say long term, because right now, if there's not enough professionals to do it, even if you put the system and put it out in the country, who's going to use it? Or how long are people going to train? But so it's long term in the sense that this can be done. Maybe in a few years, by the time you have more African professionals that are trained, but at least by the time we raise awareness and show the need for it, it's something that can be done in the near future.
Thank you so much. Another question for you. Um, uh, uh, what do you think the role of young scientists and students can play in advancing HuGAA's mission? Young scientists and
So one would
students.
be sharing. So one would be sharing what you're learning, right? Because if you go and you learn something scientific and complex, one way you can help is breaking it down in very understandable, simple format for those who don't understand. Because there's this inclination of being educationally ignorant, whereby you think that because you know it, it's obvious, but sometimes it's not obvious. So if for a young scientist towards HuGAA's mission is when you learn something, please break it down to other people that they can understand, especially if it's something that's going to be beneficial to their health. And for example, their mental health, it could be counseling, any sort of health related topic. I would say, please, when you learn something, break it down, share it in the closest person that you know. This could be your neighborhood, it could be people you live in the same compound with. Just share it in a respectful manner, whereby collectively we could eventually bring change forward.
Thank you so much. Let me ask another question. How do you envision engaging policymakers to prioritize genomic medicine as part of healthcare planning?
So in order to do that, firstly, we do need to get this bit out of the way, which is getting people to know what genetics is and getting people to know what genetic diseases are and getting them to know that they do need genetic testing. So by the time you do understand that, then you can tell the government that, hey, there are a group of people that are interested in knowing what their genetic predispositions are or what genetic diseases they have. We need genetic testing in the healthcare infrastructure. Because there are certain diseases now that are becoming prevalent, for example, kidney diseases or cardiovascular disease or some cancers, whereby if had you known perhaps earlier diagnosis, you could have found at least a sustainable plan or a method whereby the person can manage these symptoms or at least prevent triggering it, which in turn would reduce the burden on the government when they do get these diseases. So that's another thing that would be beneficial, would be if we can at least know that these people are predisposed for a certain disease, maybe by changing their diet or changing their lifestyle, they will at least not get these diseases. In that case, that will also reduce the burden on the healthcare system when they do get this disease, when it could have been prevented through lifestyle changes. So those are some of the things that we can get through with policymakers, because at the end of the day, it is quite costly, but the cost would outweigh it benefits more than what the cost would be, like if people were actually diagnosed with these diseases late onset and then the burden of care lands on government.
My last question in your webinar, what advice would you give to young African researchers entering the field of genomics?
Say that again, please.
What advice would you give to young African researchers entering the field of genomics?
I would say, in my opinion, be prepared to at least be there for as a representative of Africa. Right. You need to know that you're not just there alone, you're representing all of us, because currently there are people that are representing us in global stages. We have, like I said, Ambrose Wankam. There's also Shegun Fatuma, who is also my supervisor, who's doing amazing as well in GWAS and polygenetic course. But still, we need more. So if you are someone that is in the genomics field, I would advise, one, please reach out. Let us all connect. Let us make sure that we're bringing impact in whatever way that we can, and always disseminate your knowledge. Always share, and have Africa at the back of your head, and we can eventually develop together. That's it.
Thank you so much. There is a question in the chat from Gibrimlak from Ethiopia. How African will be institutionalized the genomic medicine?
How Africa will institutionalized the genomic medicine, or how will we institutionalize genomic medicine? I want to assume. So, should we get this genomic data, we can at least use
This is the
it.
first step. Yes, I agree with you.
Yeah. So should we get this data into the system, we should be able to use it in so many different ways. So like I said, one would be personalized treatments, right? Because sometimes you can have people whereby you're giving them treatments and you're wondering why it's not working. But it's because genetically their system is not compatible with the particular treatment that you're giving. So that's one way, right? So should we institutionalize genomic medicine? That's one thing. So that's the drugs, the personalized treatment. We can do the preventative measures, because when you know that this individual is predisposed to a certain disease, then you would be able to at least prevent it, maybe through IVF, through certain means. Because by the time we have genomic medicine, there's boundless things that we can do, as not only as a country that it is in, but continent-wise, right? So like I mentioned in my very earlier slides, so drug therapies, there's a prevention, there's an early diagnosis, there's the personalized medicine, there's a whole lot of things that we can do.
Thank you so much. Another question from Baba Fofana. Having a genetic database for Africa will be great, but how prepared are you concerning religion and religious people, knowing that religion can be a real barrier?
It's a very good question, especially if you're coming from a religious country or a very culturally appropriate country such as Gambia again. But then the thing is, using that same religion, you should not ignore your health, right?
We should note what?
Ignore your health, right? Using that same religion asks you to take care of yourself. So there's this tendency whereby in Gambia, for example, would say something like, it is God's decree. That's why you're having certain diseases also. But that doesn't mean you should not go out and seek treatment. That doesn't mean that you should just sit down and idle on yourself. It means that you should still go out. You're still responsible of taking care of yourself. So we come in another direction of saying that, okay, being a religious person as you are is why you should take care of yourself. If you're healthy, you can practice more. So I think that the difficulty might not even be with religion, because religion does promote self-health and taking care of yourself. I think sometimes it's actually even more cultural than it is religion. Because, for example, if you have cultural practices that are detrimental to some certain people, for example, some let's say you have a child that has a particular disease, say it's genetic, but it's unknown. Culturally, they might isolate that child, you might lock the child away and maybe put incense in the room to drive evil spirits away, all of those things. It might be more difficult to tell them, no, there's no evil spirit, it's just science, than to actually use religion. Religion might be a bit more easier to dive or divide than culture. But I think one thing is respect, like I mentioned earlier, communication and respect. People already have their mindset, people already have their understanding of certain things, and you don't just bring in new things. You take what they know and explain it back to them in the way they can comprehend. So we want to make sure that when we're bringing this knowledge to people that don't understand it, we're in their communication bubble. So we're all understanding each other. I respect what they're saying, and I just find a way to let them understand what I'm saying in a way that I believe that they can understand it.
Thank you so much. I have a question regarding HuGAA. Do you have current collaborator who support your activities and so on?
So currently, no. We do collaborate with other organizations. For example, we have collaborated with the Tanzanian Human Genetics Organization when they were doing the genetics ethics course to fund some Gambians to do it. We have collaborated with the Global Foundation when they were doing a SOMA drive. So we have done collaborations with other organizations, especially when it comes to teaching or when it comes to some fundraising activities, but not necessarily a funder. So currently, no.
Thank you so much. Is there any question you want to ask before we close? Okay, thank you again, Ms. Sainabou, for answering the questions and for your excellent presentation. It was a pleasure to have you with us. Thank you all for attending. We hope you found it informative and enjoyable. Have a great day. Bye-bye. Thank you so much. Have a great day. Bye.